Okay, so we are back, and this time we're going to be talking a little bit about the changes that happen in perimenopause and menopause and how that sets us up for developing certain conditions like fatty liver and high cholesterol and things like that, and how this is all connected to these hormone changes as well as changes in our gut. So I hope you're excited to dive into a little bit of nerdy science stuff. I'm going to make it easy to understand, I promise, but let's dive in. So what happens, we talked about the declining estrogen as we get closer to and enter menopause. And what happens there is we need estrogen for several things in the body. So I'm going to start first by talking about the overall gut issues that can develop when we have these declining hormone levels, such as constipation, bloating, and something called SIBO. And then we're going to dive into more of fatty liver and cholesterol and other issues there, because there's a huge role of your liver health in digestion as well, and hormones. So it's all kind of connected. I hope you're kind of putting that together. So what happens as we age? So one of the common things is we get constipated. And that constipation is due to a number of factors. One is that we naturally start having more what's called methanogens in our gut. Methanogens are actually not bacteria, they're not a virus, they're not a yeast, and they're not a parasite. They're called archaea. They're an ancient form of microbes that we don't have, too much knowledge about, and they're not as common as some of these other microbes, but I digress. They are way more common in people as they get older. And one of the theories is that because these methanogens tend to slow our transit time and cause constipation, and we know that when we're constipated, our gut bacteria has more time to extract more calories from our food. And so, especially in, caveman days, back in the day, food was often scarce, right? So we needed to have things like methanogens in our gut to extract excess calories when we did eat in order to put on a little bit of fats for some extra storage for times when food was scarce and we would go kind of into starvation mode and our body would have to use that fat on our body as fuel. So it's kind of an evolutionary adaptation where these methanogens kind of adapted to being inside of us, and they help us to extract these excess calories. So obviously a lot of us do not want that to be happening when we're trying to manage our weight, especially a lot of women as we enter perimenopause and menopause tend to be more prone to weight gain, and this is one of the reasons why. We have talked about others in the past, and I will briefly mention one of the reasons being that your testosterone also drops, and testosterone is needed to build muscle mass. And without high enough muscle mass, our metabolism goes down. But let's get back to this constipation thing. So the more methanogens we have, the more constipated we are. And as a general rule, when we're constipated, we tend to gain weight because our bacteria have more time to extract more calories from our food. So if you didn't already know this, even in those of us that aren't constipated, this is actually a role of your gut microbiome, especially in your large intestine. One of the final roles that they play is extracting calories from your food. It's one of our final steps of digestion. So I know it sounds kind of weird, but they are helping us digest and absorb nutrients and calories from our food. But when we have more of these methanogens and we're more constipated, we tend to extract excess calories than we would if we didn't have as many of these methanogens. So obviously we can do a lot to modulate this. So when you're working with a practitioner like myself, we can do a stool test to see, first of all, are your methanogen levels high? Is that the reason for your constipation? Because there are other reasons. So things like food sensitivities, other bacteria or yeast imbalances called dysbiosis, having low stomach acid and low bile, which we will dive into soon in terms of liver health, and not enough fiber, too many processed foods and simple sugars. There's many factors, including high stress, that can contribute to constipation, right? So we have to kind of rule out all these other factors, and ideally my preference is to see a stool microbiome test like the GI map to see, do we actually have these methanogens? Is that what's causing the constipation, or is it something else? Now, there are many other things that can contribute to constipation as we age as well. So estrogen is needed. Estrogen actually keeps things moving through our gut at a good pace. It's kind of a prokinetic agent. So when our estrogen declines in menopause, we have a little less, of a slower, or a little more of a slower system, I guess, and are more likely to have constipation. So that's why sometimes women notice premenstrual changes in their stool because of these fluctuating hormones, right? Where some people might get constipated and other people might get diarrhea. But we know that when hormones fluctuate, it's going to cause changes in our stool, and especially when estrogen drops, we're more likely to become constipated. So now we've got two factors, so the increase in methanogens and the decline of estrogen that are causing constipation. On top of that, we have a third factor, and that is low stomach acid and low bile. So let's start with stomach acid. We know we need stomach acid for digestion. When our stomach acid is low, we are more likely to have heartburn. I know that sounds contradictory, but hear me out. Western medicine believes that we have heartburn because our stomach acid is too high, but most people, in fact, actually have low stomach acid, and that in itself is causing the heartburn. That's because our esophageal sphincter that is between our stomach and our intestines needs acid as the trigger to keep it nice and closed and tight. If the acid or not enough acid is there, that sphincter is going to stay open and allowing any residual or small amount of acid and food that is in there to flux back up into the esophagus. And so some people might experience that as burning if you do have some acid, or if you don't have any or hardly any acid at all, you might experience more of a reflux without the burning. So feeling like your food is coming up your throat, or that there's a lump in your throat, or you can't swallow properly because the food is coming up, but there's no burning because there's not enough acid there. So that's called silent reflux. That's also very, very common, especially in those of you who have taken or are currently taking what's called PPIs, proton pump inhibitors. They're prescription strength antacids, and they are way overprescribed by the medical system because heartburn is such a big problem, and that's the only thing they have to offer, unfortunately. So in my practice, what I would do with someone with heartburn would be to look at, why do we have the heartburn? Do they have low stomach acid? Do they have food sensitivities? Is it dysbiosis, which is a bacterial imbalance or overgrowth, especially in the small intestine, which is called SIBO? We'll dive into that shortly. Or is there something else going on, right? So we have to rule out all these things. Even constipation can cause heartburn because it's causing that excess pressure and buildup in the gut, and things aren't moving along. So we have to look at stomach acid as very necessary, both for digestion and absorption of our food. So it's really important to help break things down, along with digestive enzymes and along with bile, which we'll touch on shortly. But it also importantly acts as a barrier to prevent your body from growing too much bacteria where it shouldn't be. So most of your microbiome, your bacteria in your gut, should be in your large intestine. When you have low stomach acid, whether that's natural reasons because you're not producing enough acid or you're chronically stressed, or if it's because you've been on an antacid drug, whatever the reason, when you have that, it allows the bacteria to grow out of control in your small intestine and your stomach, which can worsen things like heartburn, indigestion. You'd probably feel full after only a few bites, lots of gas, and also, importantly, especially if you have, low stomach acid, low bile, and even SIBO, which we'll touch on shortly, you're not going to be absorbing things properly. And that's going to cause more problems with things like fatigue, mental health, and more. So we really have to look at, is it low stomach acid? If it is, we have to optimize that stomach acid by getting off those medications. And sometimes it requires taking digestive enzymes with acid in them. And we can also use things like digestive bitters as well, but we have to get that acid up to keep that protective barrier there so we don't develop or worsen a bacterial overgrowth or imbalance in our upper gut. So if you tend to have upper gut symptoms like fullness, belching after meals, reflux, you're more likely to have low stomach acid, low bile, and or things like SIBO, which is that imbalance or overgrowth of bacteria in your small intestine where it's not supposed to be. So let's talk a little bit about SIBO now and bile, because this is all connected, right? So basically, if you have low stomach acid and or bile, you're going to develop SIBO. You're going to put yourself at a higher risk to develop SIBO. So this is why SIBO is more common in the aging population. So if you're perimenopause or menopause, we naturally produce less stomach acid as we age. And we actually need estrogen to produce bile. And bile is emulsifies fat. So it's produced in our liver. So if we have any kind of liver issues, which we'll also dive into soon, if we're not producing enough bile, we're not going to be having good poops either, because we need bile. It acts as a promotility agent as well, but it also acts to keep that bacteria under control. So it reduces our risk of SIBO or dysbiosis, because it's naturally antibacterial. So both your stomach acid and your bile act together to keep bacteria under control, so we don't get this overgrowth of bacteria, this SIBO, in your small intestine. Because again, when that happens, you're going to have malabsorption, you're going to have obviously digestive issues, but you're not going to be absorbing your nutrients, and that gives you a whole host of other problems like fatigue, mental health issues, then you're going to have issues with bone density, all kinds of things. So why do we have issues with bile? So we need our estrogen to produce bile. So when that starts to decline, we're going to have lower bile output. Women that have been on birth control also have issues with bile and commonly develop gallstones. And I will say right now that doctors are very quick to want to remove your gallbladder. Unless it is an emergency situation, I highly recommend you seek a second opinion and or ask to see if they can break up, if you do have gallstones, to see if they can break it up using ultrasound. Because once you lose that gallbladder, you're going to have troubles digesting fat and be more at risk for things like SIBO for the rest of your life. It's going to be an issue for you. So you want to try to hang on to that. But I digress. So we talked about the role of estrogen in bile formation and how we need bile to act as an antibacterial barrier, but also to emulsify and digest and absorb fats. So that's why people that have had their gallbladder out or don't produce enough bile for whatever reason, even if you have your gallbladder, your doctor said you don't have gallstones, it's possible to have other issues with your gallbladder and your bile production. So it could be 1, you're just not producing enough bile. 2, you have sticky, sludgy bile, which is very common. So it's so thick that your gallbladder can't squeeze it out. Or 3, you have what's called biliary dyskinesia, which is basically just a fancy term that your gallbladder is not contracting properly to squeeze the bile out. So there's many things that can go wrong. And interestingly, we have a microbiome in each different part of our body. Our skin has a microbiome, our mouth has a microbiome, our gut has a microbiome, and our gallbladder actually has its own microbiome. So if the microbes are often there, that's going to worsen the function of the gallbladder and not allow it to squeeze out that very important bile. So all that being said, bile is also prokinetic. So we're going to see how now we're seeing that, if estrogen's low combined with not enough bile for whatever reason, you're going to have more issues with constipation, right? Because it helps you move things along. And then now let's dive a little bit more into SIBO. So anyone that has SIBO are going to have upper gut symptoms. You're more likely to have it if you've had any of these factors. So there's many of them, so bear with me. You've taken an antacid for any length of time, especially if it's been years. By the way, antacids have a black box warning that they're not to be used for more than 2 weeks for treatment of ulcers. But doctors often leave patients on these drugs for years, sometimes decades. I myself was on an antacid for about 5 years, and that's what contributed to my SIBO and my digestive problems. So antacids, low stomach acid for any number of reasons, including autoimmune disease, aging, and stress. Having any kind of abdominal surgery, so having scar tissue from that abdominal surgery, having chronic constipation, use of birth control, having your gallbladder out or insufficient bile, concussions, food poisoning, trying to think if there's anything else. I think that's about it. And then other stealth infections or co-infections, things like Lyme, mold, other issues that you can develop that may be kind of lurking in your body. These are all things that can predispose you to SIBO. And so if you think you might have SIBO, do reach out to me. That's something I work on quite a bit with clients. It does take a professional approach to treat because there's many factors that we have to address. We have to kill off that bacterial overgrowth. We have to optimize your stomach acid and bile. We have to make sure that you're pooping regularly. So constipation is a big one for SIBO and any kind of dysbiosis, whether it's upper gut or lower gut. And we have to make sure we manage our stress levels, because we know for a fact that when you're stressed, especially with chronic stress, it shuts down your digestion. Okay, so not only is you're going to get constipated, but you're also not producing enough stomach acid. You're just not digesting at all because your body is prioritizing all its resources to run from danger and save your life. So this is how you can see that it's really complicated to heal the gut, and we have to address the whole person, the whole lifestyle, and not just rely on, a specific supplement or a specific type of diet to fix these problems. So I want to talk a little bit more now about medications really quickly. Then we're going to dive into bloating as well as liver health. And then we're going to dive a little bit more into mood changes and fatigue, and then looks. So a lot of us women, we are concerned about our looks as we get older. So skin changes, hair changes, and nails and weight. So we're going to talk about that a bit more too. We've already kind of touched on metabolism, but to sum up this section, basically, we have to address the gut health in order to optimize our hormones, and we know that they interact with each other, right? So as estrogen starts declining, we're more likely to be constipated. We're more likely to have issues with bile and digestion and develop SIBO. And the more everything is backed up here in your upper gut, including your small intestine and liver, the more likely you are to have worsened hormones, because our liver and all of that has to be functioning optimally to build and balance our hormones. So that's really important. We're going to dive into that soon, but I want you to just know quickly that your liver plays a big role in monitoring the hormone situation. And if things are out of whack, for example, you have too much estrogen, it tells the body, okay, we've got too much, we're going to pack up some of it and send it to the gut for excretion. But we know that the gut plays a huge role here, in that if you have the wrong balance of microbes in there, so mostly these inflammatory bacteria, they make an enzyme called beta-glucuronidase, which is basically taking that estrogen and recycling it. So instead of allowing your body to excrete it in the feces, it's recycling it, saying, no, we're going to reabsorb this into the system and keep it in the body. So estrogen is becoming higher and higher, and you're developing more estrogen dominant symptoms such as bloating, mood changes, insomnia, weight gain, all of these kind of things. Pain and painful periods if you're still menstruating. So ideally, we need to have that liver functioning well, so we're going to dive into that soon. But I briefly just want to touch on one thing before we leave this section, and that is medications. We talked already about the use of antacids, so that is a big one that we have to avoid. The second one is antibiotics. And I work with a number of clients, pretty much all of my clients have taken a lot of antibiotics in their life, often because they've had health issues from a young age where they were getting, frequent sinus infections, ear infections. As they got older, maybe they were getting more UTIs and yeast infections. And so they were routinely put on antibiotics. And unfortunately, 10, 20, 30 years ago, we didn't know what we know now about the importance of the microbiome. And many doctors would just hand out antibiotics and not say anything about, restoring the microbiome afterwards, because they just didn't know. It's still fairly new science, and many doctors still don't tell, especially women. It's very important for women to repopulate the gut after, because that's why we're more prone to things like recurrent UTIs and yeast infections when we don't have the healthy bacteria down there. And I want you to know that your vaginal microbiome in your uterus is directly connected to your gut. So if you have dysbiosis in your large intestine, you're way more likely to have dysbiosis in your vaginal microbiome and your uterus, because these things, they translocate. The bacteria can move back and forth. It's kind of gross, I know, but it also has to do with the pH shifts as well. But I want to just bring it back to antibiotics for a moment. So if you are someone who has taken antibiotics, especially if you've taken them frequently in your life, we need to, first of all, you probably already have dysbiosis because you didn't repopulate the gut afterwards. And we need to do that by eating lots of fiber. We also use probiotics, fermented foods. There's many, many things that we can do. I want you to know that probiotics are not the only answer or the answer. People think, oh, I'll just take a probiotic, I'll be fine. As of right now, as far as I know, the current probiotics that are on the market only stay in your gut for up to 14 days. They are transient. They basically go in and they go out eventually. They modulate the environment while they're in there and they make you feel good. But if you don't keep taking them consistently, you're not going to see the benefit of them. So the importance here is that we really have to modulate the diet and bring in specific fibers and fermented foods and certain types of foods in order to encourage the growth of your own natural healthy bacteria, okay? So whatever's in there, we have to encourage the growth of it, because without doing that, those probiotics are not going to stick around. So you're going to be taking them the rest of your life, right? Hopefully, eventually they'll come up with probiotics and also things like fecal transplants, which are in the works, where they will stay in the gut longer, but as of right now, it's not a thing. So what I want you to know is that if you've taken the antibiotics in the past, you likely have some degree of dysbiosis, which we have to address. And that could be either too much bad guys and not enough good guys, or sometimes it's not necessarily that you have a lot of bad microbes in your gut, but you just don't have enough good microbes. And that can be for many reasons. So obviously the antibiotics is one reason, but the other one is stress, constipation, and poor diet. So again, bringing it back to diet, knowing that most of us here in North America eat a lot of processed foods that are high in carbs and sugar, preservatives and chemicals, and very, very low in things like fiber, fruits, and vegetables. So if you're gonna do one thing for yourself, a simple thing would be to eat more home-cooked meals with less packaged foods in them and increase your fiber intake. Now this becomes an issue if you already have dysbiosis. You likely don't tolerate most fibers very well. I'm willing to bet that most fibers give you gas, bloating, either constipation or diarrhea, and indigestion of some sort. If you've gotten to that point and you really can't tolerate a lot of fibers, you have to book a session with myself to do this gut healing protocol to kill off the imbalance and restore balance to your microbiome. Because it's only once we do that that you're able to tolerate more foods, especially higher fiber foods. So that's the great thing about working together, which I get excited about, my clients get excited about, is that you temporarily sometimes have to restrict things. Like, yes, I may ask you to go gluten-free or dairy-free for a few weeks or a month, but in the long run, because we're healing that root cause and bringing down the inflammation, optimizing your digestion, you're able to bring in all of these foods that you had to avoid for so long, and now you can eat such a wide variety of foods. By the time we're done working together, you can eat those foods that you've been missing without having symptoms. The goal is not to stay on a restricted diet for life, and too many people do that because they find a diet that works for them and they figure, okay, I'll just have to avoid this forever. But that's not treating the root cause, right? As soon as you eat that food, you're gonna have the symptom again. But what if you could eat that food and not have the symptom? That's where the true healing is, okay? So anyways, I just want to let you know that antibiotics, they do a lot of damage to the gut, especially if they are the very strong ones. If you've done triple antibiotic therapy for some kind of, H. pylori or other illness or infection that you had, you really have to heal up that gut and balance things out in order for you to move on with your gut healing journey. Because we know for a fact that having the wrong bacteria or not enough good bacteria is causing many things in the body to happen that are going to make you feel worse and worsen your transition and the aging process. So you're going to be more likely to put on weight, more likely to have blood sugar imbalances, high inflammation, more headaches, more aches and pains, more food intolerances, more fatigue, poor mental health. All of these things are related to the health of your microbiome. And so if you're struggling, I highly encourage you to reach out. I'm going to end it here for this video, and we're going to move on in the next video to talk more about liver health and how that impacts digestion and hormones, as well as the role of absorption. And we talked a bit about SIBO. We're going to dive more into the role of absorption and how that impacts things like fatigue and mental health.